Cystic fibrosis is an autosomal recessive disease. It causes really thick, sticky mucus that clogs the lungs. Patient is prone to having lots of lung infections. It also involves epithelial lining of the gastrointestinal and reproductive tract. So your exocrine glands. It is a horrific disease. We hear a lot about it, but there's only about 30,000 patients nationwide that have cystic fibrosis. It is a major cause of chronic respiratory disease in children. So, signs and symptoms. You have very viscous mucus in the bronchi. You can also have steatorrhea and abdominal pain. It affects your eating, so the pancreatic function is abnormal in approximately 80 to 90%. So, how do we diagnose that? Well, usually they now diagnose, they do a test on an infant when they're born if there's a suspected chance. A genetic study, and they do what's called a sweat test. So it's called a chlorine sweat test, sodium chlorine sweat test. Treatment for these patients, it's lifelong. You need to make sure that they don't get infections. They take their pancreatic enzymes. The one thing you have to do is you've got to do physiotherapy, lung physiotherapy on them. Bronchodilators to cough up mucus. There's another thing called enzymes to thin the mucus. Antibiotics so they don't get infection. Average age patients about 32 years. Some live into the 40s and 60s, but these people have cystic fibrosis lifestyles. The only somewhat cure is to get a lung transplant. But that still means you have the genetic problem. It does give them longer life, but it doesn't cure it. So these patients have, every day, they have a very productive cough, they wheeze, they weight loss, they have hyperinflation of the lung fields, they pretty much have a barrel chest. Over a long period of time, they're going to have clubbing in the extremities and the fingers. Every day, they have to have chest physiotherapy, so it's chest percussion. They need to do a lot of postural drainage, breathing exercises, a lot of fluid intake just to make sure they can get the mucus out. They need to take enzymes when they eat all the time. There are a lot of support groups for patients and families. This is something that needs to be treated every day, twice a day, whenever needed. You can't put it off. You can't skip a day for treatment because it'll increase the risk for an infection, increase the risk of getting mucus plugs in your lungs. It increases so many problems. So it's a very chronic, horrific disease that these patients have.